Okay, alors session with Dr. Paul Roumeliotis, who is our Chief Medical Officer for the Eastern Ontario Medical Health Unit. And both Dr. Paul and I thought it would be a good occasion to provide information because the vaccination campaign will be starting, if it hasn't already been started, for the groups for children from 5 to 11. But before that, I would ask Dr. Paul just to provide a short update on where we are.
Sure. Thank you very much, Francis. Merci beaucoup. Il me fait plaisir de répondre aux questions et de vous donner une mise à jour aujourd'hui au niveau de où on est avec COVID-19 dans notre région. Je me souviens, on avait l'année passée, on n'avait pas l'espoir qu'on a actuellement parce qu'on n'avait pas de vaccin qu'on avait fait la dernière avec Francis Drouin. Donc, je pense qu'on a des meilleures nouvelles, mais je comprends qu'il y a beaucoup de questions. I'd like to thank Francis for organizing this. I do realize the parents have a lot of questions. As a matter of fact, I was talking before in French, and I was saying that last year, this time we didn't have as good news in front of us. We had a few, and we kept talking about what things are closed, what things are open. Right now, we're in a much better position. We vaccinated a high percentage of the population. We're really starting to get a better control. Not there yet, but I think we're much better off today. So I'm going to be giving just a very quick update of where we are and then talk about some vaccines. Donc, je vais commencer avec où on est au niveau des cas ontariens, puis on va aller dans l'Est d'Ontario tout de suite. Donc, à l'échelle provinciale, on voit qu'on a un plafonnement des cas soit 700 à 800 par jour. Donc, ça se plafonne. Mais la bonne nouvelle, c'est que on n'a pas une augmentation qu'on avait dans les troisième et quatrième vagues au niveau des hospitalisations, des mortalités, tout ça. Donc, autrement dit, les vaccins font leur travail. Ils préviennent, dans la plupart des personnes, la maladie, mais plus importante, ils préviennent de façon très importante l'admission à l'hôpital, l'admission aux soins intensifs et les décès. Donc, tout ça a diminué depuis qu'on a commencé à vacciner. So, basically, in Ontario, we've had now we're kind of flattening around 700 cases a day, and that is much less than we had in the fourth wave. In the third wave, we had 4,500 peak in one day, and we had a lot of hospitalizations. Now our hospitalizations are very low. Our ICU admissions are low, and what we're seeing is decreased rates. I think because of these vaccinations, we're very high vaccination rates at this point, and that is shown by most of the cases that we have are among unvaccinated. We have most of the hospitalizations are among unvaccinated and ICU admissions and deaths as well. So we have now been able to prevent disease, even more significantly prevent hospitalization, prevent the severe complex disease out of that. So that is the good news. Now, we have been hearing a lot of news now since Friday about Omicron. Omicron is the new variant. And what happens is when viruses grow and go from one to another, particularly into a lot of people, like it is in South Africa where they discovered it, we know that viruses mutate and they change. The more people they infect, the more they change. The problem is in South Africa, there's only about 25-30% people vaccinated. So there's many people that the virus can go into, and we know that. So we know the virus mutates, and this mutation has been shown to have multiple mutations, but we're not sure if it's going to be more easily transmitted, if it's going to escape the vaccines, or is it more severe? We don't think it's going to be more severe because what we've seen is mild cases. However, they're saying that it might be more contagious, but it's hard to say in a place that's virtually not vaccinated. So we're gonna wait on that. And finally, about vaccines, we know that at one point or another, these viruses may be a bit resistant, but not completely zero resistance. So we're starting on a good foot. And I'll talk about how we can get that later. Donc, au niveau qu'est-ce qu'on voit d'échelle mondiale, comme vous avez bien entendu, j'imagine, on a une nouvelle souche, une variante qui s'appelle Omicron. Ça, c'est une souche qui a commencé à s'évoluer en Afrique du Sud, dans laquelle nous avons une population au maximum 25 à 30 vaccinés. Donc, la plupart des gens ne sont pas vaccinés. Ça, c'est un terrain très, très fertile pour le virus d'aller commencer à faire les changements, les mutations. Et ces mutations pourront donner, par exemple, une augmentation de la façon de transmissibilité, peut-être une résistance aux vaccins que nous avons ou peut-être une maladie plus sévère. Au niveau de maladies plus sévères, jusqu'au moment, on sait que le virus donne les maladies légères. Ça se propage peut-être un peu plus vite que l'autre virus qu'on a actuellement, le Delta. Par contre, il faut dire que dans le contexte de l'Amérique du Sud, Afrique du Sud, nous avons presque 75% de la population qui n'est pas vaccinée. Donc, c'est un peu difficile à faire de comparer les deux. Et finalement, au niveau de vaccins, on pourrait avoir une diminution de protection, mais pas à zéro. On est bien protégé, donc on va faire des étapes pour nous protéger plus. So what we're going to do now, really, in terms of what we want to do, and don't forget that we still have the Delta variant. You know, I know we had a couple of cases in Ottawa, and I think 5 totally in Canada, but all of our cases are Delta, and so we need to keep our eye on that. We need to continue with public health measures, and we need to continue vaccinating everybody. And in addition, and that is going to protect us. So if we do all those things, we'll be at the highest level of protection if we discover in a couple of weeks that this Omicron virus is more dangerous or is a bigger threat. So regardless, so even now is another reason. The first reason to get everybody vaccinated, including kids, is so we can get back to normal. Really, that's what we want to do. However, this Omicron gives us another push to get vaccinated, both in terms of getting your first dose, getting your second dose, getting your third dose. We will start vaccinating third dose on people less than 60 very shortly. It'll be announced next week. I'm not sure which one. It'll be announced this week for probably December, but for sure between now and next year, people will require a third dose. And what we're here for today is because we're going to be talking about kids' vaccines, 5 to 11. Now, en français, je veux dire aussi que au niveau de qu'est-ce qu'on pourrait faire pour l'Omicron, pour l'éviter, pour qu'on puisse être dans la plus meilleure position, premièrement, il faut continuer avec les précautions de santé publique. En effet, le menace actuellement, c'est le Delta, le variant Delta qu'on voit. Il y a peu de cas d'Omicron, mais même à ça, on devrait continuer avec les mesures de santé publique renforcées et aussi de continuer la vaccination, incluant première dose, deuxième dose, troisième dose, qu'on a déjà commencé chez les personnes plus que 70 ans. Et ça va commencer bientôt pour les personnes moins âgées. Donc, on va vous tenir au courant d'ici une semaine pour ça. Et on rajoute les enfants 5 à 11 ans. Tout ça ensemble va nous mettre non seulement en bonne position pour qu'on puisse, en mois de mars à peu près, de diminuer et commencer à avoir un peu plus de normalité dans nos vies, mais ça va nous mettre préparés pour le pire si, disons, que l'Omicron est plus sévère ou plus facilement transmis ou qu'il y a un petit pourcentage de diminution de protection au niveau de vaccin. Donc, on a toutes les bonnes raisons pour commencer à se faire vacciner et c'est pour ça qu'on est ici, parce que là, on rajoute dans la population les enfants 5 à 11 ans. So we're adding the children 5 to 11 years of age. We have clinics all over this. I want to say that this vaccine has been out now in the United States for over a month. They vaccinated over 3 to 4 million children. So far, there hasn't been any severe side effects reported. And we do know that with vaccines, it is a normal process that when any medication or vaccine that comes out, it starts with adults getting accepted for vaccination. Then we have experience. Then we look at the studies in younger populations. Then we go to 11 to 17 years of age. Then we go to 5 to 11, and then the younger age group. And that's standard for any medication. That's the way it is locally and internationally. So the vaccine now is available in Canada. It's been approved by Health Canada. It is safe, it is effective, and we do know that it's worth giving it to children because even though in most children there is mild illness, we have had children that have died. We've had children, particularly those with underlying medical conditions. We have had children that have been hospitalized and have had long-term complications. And so we do need to vaccinate them. The other reason to vaccinate children is also it adds to the protection of the community, and it actually stops the disruption in the school. Since we vaccinated the majority of 12 to 17-year-olds, we've had no cases in schools and minimal outbreaks in schools. The only outbreaks we have now are in elementary schools. So the vaccines are ready. Donc, au niveau des vaccins pour les enfants, ça c'est la clé, à mon avis, de rajouter. Mais je veux juste dire que au niveau de qu'est-ce qu'on voit avec les vaccins ordinaires. Juste pour commencer, aux États-Unis, au moins 3 à 4 millions de doses étaient déjà données parce qu'ils ont approuvé la version pédiatrique, ça fait à peu près un mois. Aucun effet secondaire majeur n'a été rapporté jusqu'à date. Mais je peux juste vous dire que pour les vaccins, pour les médicaments, il ne faut pas oublier que je suis pédiatre aussi, donc c'est ça que je vois depuis 30 ans. On commence avec, si c'est un médicament ou un nouveau vaccin, on commence toujours à en faire avec les adultes seulement. Après ça, on a des études pour les enfants de 12 à 17 ans. Puis après ça, on va à 5 à 11 ans. Donc ça, c'est des étapes normales qu'on va avec n'importe quel vaccin. Les enfants sont, à mon avis, sont malheureux. Heureusement, on ne voit pas la plupart des enfants qui vont atteindre le COVID-19 ne vont pas avoir des problèmes à long terme ou des complications sévères. Par contre, on a vu des enfants hospitalisés, morts, des mortalités, mais rares, ça c'est heureux, mais on peut avoir des complications. Une autre raison pour les vacciner, c'est plutôt de commencer vraiment à donner une plus grosse protection communautaire et aussi d'éviter les interruptions qu'on voit aux écoles. Maintenant, presque tous nos flambées et les cas que nous avons, et il faut tester la classe, il faut terminer la classe, fermer les écoles, etc. Tout ça, c'est les écoles élémentaires, pas les écoles secondaires, parce qu'on a vacciné plus que 80% des enfants de 12 à 17 ans. Donc, on a des très bonnes raisons et je pense que ça vaut la peine de faire vacciner les enfants. Je comprends que les parents ont des questions, c'est normal. Comme pédiatre, je le vois en tout temps. Je vous conseille, si vous avez des doutes ou vous avez des questions, s'il vous plaît, consultez votre médecin, consultez les sites scientifiques. Nos sites web, on a beaucoup d'informations parce qu'il y a beaucoup de misinformations, beaucoup des erreurs, beaucoup des choses qui ne sont pas vraies. Donc, je vous encourage de faire vacciner vos enfants entre 5 à 11 ans. Et si vous avez des questions, d'aller aux sources fiables pour avoir votre information. So just one more thing, I'll say in English. Yep. Again, I know people are hesitating for, sometimes their parents are hesitating. We know that about 50 to 60% of our population will get their kids vaccinated right away, and we're ready to do so. But I know that there's another, 25, 30% that have questions and want to wait, and I don't blame, I understand. But what I'm saying is if you have questions, please ask your doctor, please ask your healthcare provider, so we can then give you reliable and scientifically based answers to your questions.
Okay, well, thank you for that update, Dr. Paul. And just to be clear, the vaccination campaign for children from 5 to 11 has begun in Eastern Ontario. And
yes.
How does that look for? Is that going to be happening in schools, or is that going to be at a vaccine clinic? Or
Thank you. Yes, thank you. So a lot of the information is on our site and our website, but I can tell you that overall we have almost daily clinics all over our area where people can get an appointment through the system, through the normal system that we have with the government, through the provincial portal, and get an appointment. So far, we've vaccinated over 1,000 children in a couple of clinics. So we're doing quite well, no problems whatsoever. And so that's one way. The other way, there are participating pharmacies that offer it to 5 to 11-year-old age group. It's on our website. You can get a link to that. You can find it out. In addition, there will be some primary care doctors, some clinics, and more importantly, we're going to be doing school-based clinics on weekends on a rotating basis throughout our region. We're starting this weekend, and it's going to be in Prescott-Russell and SDNG all over. Go to our website, and you'll find where we are. We've selected schools geographically, and parents can go to the school that's closest to them, regardless if the child doesn't go to that school or if they're not in the same school board. We've done it geographically. So that we're sharing it with the schools. So there's multiple ways. Those are walk-in. There's no appointment necessary. Donc, au niveau de disponibilité des vaccins, nous avons commencé la semaine passée. Déjà, nous avons vacciné plus que 1000 enfants et on continue avec presque les cliniques quotidiennes à travers de l'Est d'Ontario. Et vous pouvez aller sur nos sites web, vous allez trouver où on l'a. Vous pouvez aussi prendre rendez-vous pour ces cliniques. Nous avons déjà 3 ou 4 000 personnes déjà bookées d'ici fin décembre. On a encore la place pour ça. Et n'oubliez pas que c'est disponible chez les pharmacies aussi et chez votre médecin si il ou elle veut. Mais de façon importante, je veux dire aussi qu'on aurait aussi des cliniques tous les fins de semaine qui commencent cette fin de semaine qui vont changer en rotation à travers de toute la région, Prescott-Russell et plus loin, on l'offre seulement pour les enfants et leur famille, sans rendez-vous. Donc, pour faciliter l'accessibilité, donc vous avez beaucoup de choix et vous pouvez trouver toute l'information sur notre site web bsco.ca.
D'accord. Docteur Paul, j'ai des questions qui m'ont été envoyées oui. Auparavant. Puis on parle, il y a des parents dont, pas par leur faute, mais leurs enfants ou leurs filles, leurs garçons ou leurs filles ont des allergies sévères. Oui. Donc, on peut penser aux produits laitiers, aux arachides, etc., etc. Est-ce qu'il y a des raisons de croire que le vaccin pourrait causer des effets néfastes pour ces populations-là?
C'est très théorique. Je peux vous dire que selon qu'est-ce qu'on voit, l'expérience, c'est très, très rare qu'on a des réactions sévères anaphylactiques, même chez les personnes très allergiques. Donc, il n'y a pas de problème. On prend toutes les précautions. Et je peux vous dire que c'est très rare qu'on a trouvé l'allergie. C'est très peu. Dans les millions de doses qu'on avait données, c'est très peu. Et même, il n'y a pas on avait peur, mais là, avec l'expérience, mais par contre, on est prêt, on a l'adrénaline, on a tout ça dans notre clinique, mais je peux vous dire qu'on n'a eu aucun problème significatif dans ce sens. Donc, il y a toujours le risque, oui. Mais ce n'est pas une raison de ne pas être vacciné.
D'accord. Donc, si un parent est inquiet parce que son enfant a des allergies sévères, la clinique où elle va se faire vacciner sont équipées justement, si jamais il y a une réaction majeure, elles sont équipées avec des professionnels de santé. On parle souvent, and I'll switch to English this time, but we often talk about, or I often get questions about long-term effects of vaccines and whether or not you'll often hear folks being concerned about, well, we haven't had, the mRNA vaccine hasn't been around for that long, so, we don't know the long-term effects. And is that something that people should worry about?
Well, you know what? That's with every medication and everything. That's a question that we have when it comes out. At this point, we know that vaccines have been safe. The routine way of making them, I know it's a bit different, but we do know that in general, vaccines are safe. Obviously, we monitor them moving forward, but I can tell you that we're very confident about vaccines. And we're also saying that the risk of perhaps a longer term or even shorter term risk is far less than if you got COVID. And so we do believe that the benefit far outweighs the risk. Obviously, that's why we have mechanisms in place to do surveillance and so on. But I can tell you that in the pediatric age group, the side effects that we see, like in the older individuals, like pericarditis and myocarditis, have not been seen yet. And I don't expect to see them or very little. But there's a 20-fold chance increase if a child gets COVID that they will get a myocarditis.
Okay. The other question that a constituent sent was with regards to clinical trials, and I think you've alluded to this before. just before the session, in the clinical trial, I believe there was about I guess that's the phase 3. There was 4,500 people vaccinated. What about the risks for the 1 out of 100,000 or 1 out of 1 million or 2 million, and the risks associated with those rare cases?
And that's what we do when we follow up on the real-time world surveillance. Right now, I think in the world there's something like 5 billion doses given, like it's in the billions. In Canada, it's in the millions, 50 million. So as we go with time, we look at those things, but we haven't seen anything in there. I can comment that about even in kids, it's 4,000, but now we've given it to 5 billion people. So we do have world data. So the world data shows us that they're safe. We know how long they last and so on. And I can also tell you that for pediatric, the 5 to 11, there's millions already given in the United States. So yes, we have 4,000 or 5,000 study, which is a big study compared to other studies. But if we now follow, because it's new, there are the very severe surveillance mechanisms that we have that look at them. And right now, like I said, in the United States, it's millions of cases. So it's much more than just for like real life, vaccinations.
Right, and any phase 3 clinical trial never includes millions and millions of people,
as
you said. So it's not something that was invented just recently. I mean, in the scientific process of the clinical phase 1, phase 2, phase 3, that's
a standard thing. That's all we've been doing. And also the age range. When we do the ages, adults, teenagers, kids, and then babies. It's always like that.
And on that question, are you? I heard the chief medical officer, Dr. Tam, speaking about this, but there are clinical trials for children under 5 years old right now, ongoing right now?
Yes, there are.
Okay.
Yes, there are. I know that Moderna and Pfizer are doing studies on children 6 months to 4 years of age. I do believe that they'll be ready to submit next year sometime.
Okay, so we may once we're ready to do that, then as a parent, I will have questions. So we'll bring you back online and we can discuss this.
No problem.
Hopefully they will be they'll be safe, and because I know I'll line up to get my son vaccinated.
Well, I can tell you. Listen, of course, they're not going to be released if they're not safe, obviously.
Yeah.
And don't forget that we're also looking at different age groups. I'll be honest with you. If it's safe for the 5 to 11s, if it's safe in a 12-year-old, it's going to be safe in a 10-year-old. There's not that much difference, but. Still, we need to do the studies. And the other thing too is they're not only doing the studies for safety, they're looking at efficiency, like what dose do they need? Like, for example, the 5 to 11 years of age, they're getting a third of the dose of the adults, because it's not based on body weight, it's based on maturity of your immune system. So we may have to even tweak it in younger kids. Depends on that. Those where the studies are as well. In addition to, of course, looking at side effects.
Okay, so in adults, it has nothing to do if somebody weighs 100 pounds or 200 pounds. It's got nothing to do with that. It's just about the age of your body, the development of your body.
It's the way that your body reacts and those. Yeah. There are, and that's different from like medications. So it goes by weight,
Yeah.
It's different.
Okay. Une autre question. Toute la question, it hasn't nothing to do with the 5 to 11, but just the question of boosters. And why do we need why we may need boosters in our population. Can you talk about this for a little bit?
Yeah, it's a very good question. Look, first of all, we know that many vaccines need boosters, and this being a new vaccine, we're going to learn moving forward. When I was starting as a pediatrician back in the 80s, we were giving whooping cough vaccine only in the first 3 or 4 years of life. And then we found out that, it wears off, so we give a booster at 14. And then we find that, it wears off, we give another booster before age 65. So this is a normal thing that we see. And children's vaccines, in order for them to work, they get at least 5 or 6 doses. So it's not unusual. In this situation, what we did is we looked at the first and second dose, and we have studies now that are looking at the vaccine efficacy, blood tests, and so on, to see how long the immunity lasts. And so for the mRNA vaccines, we know that at least for the first 8 months, the protection against severe disease stays at 90%. However, between 6 and 8 months, the protection against the infection goes down to about 80%. It decreases a bit. And so we want to make sure that And then we don't have any longer studies because we're going to be moving forward. So based on those, we want to give a third dose. And if you look at elderly, they have a poor immune reaction, and therefore they needed it earlier. And that's why we started with the elderly and long-term care. So we would need a booster. The question is are we getting another booster? Are we getting another booster? We're not sure. We believe that this third dose will really give a more prolonged effect, and we'll just wait and see how that is. Do we need it yearly? I can't tell you. I can also tell you that this coronavirus is actually very smart. It's very difficult for us to get a vaccine on it. So I'm glad we have one because we've never had one before. The coronavirus actually causes a common cold. And so we know that, so we may need a booster or we may need a different one. And just I'll preempt the question, what happens if there's a Omicron is resistant? Well, we can actually tweak it very quickly and add a booster that will get the Omicron. So I can't really answer you, will we need it every year? Will we need another one? I'm not sure, but that's the way we're going to learn. And it's not different than any other vaccine. Hepatitis, all these things, meningococcal vaccines, pneumococcal vaccines, all the vaccines that we have, we always evaluate and see, do they last forever? Do they last a couple of years? And then we act accordingly.
Okay. Thank you. Because I think I was listening to you talk on a CFRA. You were saying, every year the flu vaccine, we're never sure which strain, but they're able to modify, and that's it's most likely for now. We know that as you've explained, the booster we may be needed in a few months with the elderly population, and then depending on the variants and whatnot.
Yeah, that's right. But right now, as it is, we know we are protected, but it may start waning. That's why we're giving it, and that's why, in addition to us being at the highest level of protection, we're now going to be pushing out the third doses for individuals less than 70 years of age. That's going to be announced in a week or so, or probably this week, because we want to make sure that we're maintaining a high level of protection, and high enough that even if the Omicron or a new variant that comes, even if it's a bit less effective, the vaccine, at least we have a higher rate of protection. So we're starting at a better foot. So that's why. But regardless of the Omicron, the Delta, we know that that's going to be the key. So we know that the third dose plus expanding the age groups will be the key to achieving a very high level of immunity that will allow us to then start with removing public health measures and going back to some sort of normalcy.
Okay, yeah, thank you. And I know that there's folks asking about how quickly will we get back to somewhat of a normal. I can say that with Omicron, yesterday the federal government announced some border measures, and the Minister of Health, at the advice of the Chief Medical Officer, they're buying time to study Omicron and to see. I think you've alluded to this at the beginning. We're just buying time to make sure that if it is more severe, then obviously measures. And I'm sure, Dr. Paul, you're certainly not advocating for more lockdowns and and more shutdowns. That's not something that as a person you'd be advocating unless it was extremely necessary.
Yes.
But those are extreme measures, and with the population that's vaccinated so far, we've as you've said, hospital rates seems to be they're manageable.
Yeah.
Okay, I've got see, another person is asking about Lyme disease and whether or not this could be an issue for the vaccine.
I don't believe so, but I could speak to the doctor about that, but I don't believe so. I don't think there would be any reason to, unless I don't believe so.
Okay. And I guess the overall message, if parents are somewhat concerned, then get the vaccinated through where you have support and feel comfortable, where you have primary care available. Yeah.
Yes. And that's the thing, and kids with special needs and so on probably should get from their healthcare provider, pediatrician, and so on. Again, if there's, complicated condition, but I can also tell you that kids with complicated chronic conditions are probably more at risk for complications of COVID, and they're the ones that need to be vaccinated. But I urge parents to speak to their doctor, and overwhelmingly, most of the kids will benefit from the vaccine because they have a higher risk of complications, particularly if they have underlying medical conditions.
Okay. Dr. Paul, is there something else you'd like to add on this chat? We're hitting the half an hour, so I don't want to make this last longer than we need to. Est-ce qu'il y a quelque chose d'autre qu'on voudrait ajouter? Est-ce qu'on sait quand que la prochaine campagne de vaccination va avoir lieu? Et si on a besoin juste pour répéter pour les parents, si on a besoin des informations sur les campagnes de vaccination, c'est évidemment d'aller visiter le site web du Bureau de santé.
Oui, allez visiter notre site web. Nous avons des pages spécifiques pour les enfants de 5 à 11 ans. Donc, on parle j'ai une panoplie de questions que j'ai répondues, vraiment en détail sur cette section. Nous avons aussi toute l'information de où vous pouvez prendre votre rendez-vous, quand, etc., à travers de notre région, incluant la liste au niveau des écoles, tout ça qu'on pourra avoir. Et aussi, on a beaucoup de formations, comment préparer votre enfant, parce qu'un jeune enfant peut-être il a peur, etc. Nous faisons le mieux d'avoir vraiment une place le plus confortable possible pour les enfants. On donne les petits jouets, etc., pour qu'on puisse donner la confiance aux enfants. Et aussi, nous avons sur nos sites web des petits trucs, comment parler à votre enfant, comment préparer votre enfant, nous, on a des sprays qu'on peut mettre sur la peau qui gèlent, donc ça fait pas mal. Et aussi, nous avons fait une vidéo, très bonne vidéo, comment tenir votre enfant pour l'enfant sera le plus confortable pendant l'injection. Donc, on a tous ces ressources sur nos sites web. Et j'encourage encore des parents, s'ils ont encore des questions, n'hésitez pas à consulter leur médecin ou leur professionnel de la santé.
D'accord. Écoutez, Dr. Paul, and just before I let you go, just in English. So if parents are looking for information on vaccination, they go to the Eastern Ontario Health Unit website.
Yes, and they'll see from the front page, there's the front page of these kids' Superman capes, and they just click on that. It'll take you, we have a special section dedicated to pediatric vaccination, 5 to 11 COVID vaccination. There's an Ask Dr. Paul section where I've answered dozens of questions, of common questions that parents have. There's also a list of where the vaccine clinics will be, how to make an appointment, which ones are walk-in, which ones are not. It's all there. We're also, and I'm saying for our walk-in clinics, I would also want parents to know that if they want to get vaccinated, go ahead and get vaccinated, or bring your 12 to 17-year-old if they haven't got the first dose or need a second dose. That's important. Also on our website, we have a whole section on how to prepare your child, how to talk about vaccinations. Our clinics are made specially to be, as kid-friendly as possible. We give little toys, and our staff have hats and all that, so just to make it pleasant for the kids. And we have a pain control. There's a little spray that we can put on the children, and we also have on our website how to talk to your child, how to prepare your child, and we have a video now that we just made on how to hold your child. There's certain ways you can hold your child. So it's all on our website.
Okay, and then I just got a recent good question, and it's actually with regards to vaccine, showing proof of vaccination. Right now, it is mandatory for 12 and over in certain public places, but it's not currently mandatory for 5 to 11, obviously.
Yeah, at this point, there's no plan to make it mandatory. At this point, this is what that we've spoken to. It's a Ministry of Health from Ontario that at this point we're not looking at it at this moment.
Right, because the vaccination campaign is just is currently, we're just starting. So
it's just starting. So we don't know how manageable that is or how appropriate that would be. And don't forget that by the time we start vaccinating kids and get a higher rate of immunity, it'll be spring, and at that point we'll start removing vaccine passports, if that part of our restriction. So I think the government has said, wait and see for that. The other thing I want to say is that there's 2 doses. I forgot to say it. One first dose, and the second dose is 8 weeks apart. Okay.
So 2 months apart. Yeah.
2 months apart. J'aimerais juste dire, je vais faire en français, la dose pédiatrique, c'est 2 doses. 8 semaines à part, première et deuxième dose. Donc, on aura une deuxième dose dans la nouvelle année pour les enfants qui vont se faire vacciner d'ici la fin de décembre.
Super. Dr. Paul, merci beaucoup à toi et ton équipe, et je vais en profiter pour vous souhaiter un joyeux Noël et une bonne année. en espérant que l'année 2022 sera une année beaucoup plus prospère et sans COVID-19, si on peut l'espérer. So just, yeah, Dr. Paul, thank you so much. I want to wish you a Merry Christmas to you and your team, who've done an awesome job at protecting us in Eastern Ontario. And hopefully the new year will bring a brighter future ahead. So thank you so much.
I hope so. Thank you. Merci.
Take care. Bye-bye.
Bye-bye.